Hello and welcome to a how-to video of how to utilize and take advantage of our new health plan cost analysis tool that is actually a calculator to help you understand your full annual cost, risk, predictions for you and your family's needs this year so you can elect the best health plan for you. So how you're probably going to gain access to this calculator is either in an email from myself or on a link from the webpage. So I'm just going to show you start to finish how do we utilize this and gain access to it. So say you get an open enrollment email from me, we're going to click on our health plan cost analysis tool here on this link. It is automatically going to download it here. All right, if you do have Excel on your computer, you'll just open it right up and start editing. However, I do understand that a lot of employees and teachers do not have access to Excel, in which case we will utilize Google Drive. If you receive an email with this cost plan analysis tool, you can go down in the attachments of an email, click Open With, and then hit Google Sheets. If you downloaded it and realize that you do not have a Excel and are not sure what to do, we can actually bring it straight into Drive. So we're going to head to Google Drive. We're going to select New File Upload. Navigate to our downloads. We know we just downloaded this price tool. Down here on the right, it's going to say one upload complete. Perfect. I like to show file location. Make sure I know where it's at. It has it highlighted. We're going to select these three dots. Open with Google Sheets. And now it's going to open the calculator here. For ease, I'm just going to edit and explain in the Google Sheets form. If you are in Excel, it works the exact same. So this calculator is meant to make your life easier, not harder. Do not totally tear yourself apart trying to figure it out if it's not helpful, but I do really hope that it helps you feel educated and confident in your decision when you're deciding your health plan with the district, because I think it's really good to make sure you comprehend the whole annual cost of these different plans. Before you really dive in, I encourage you to get a full understanding of our three health insurance plans that we offer. You know, we have a basic 2000 plan and two different high deductible plans. There is a full educational video and content on just the health plans if you want to dive in. But here are just some overviews. What are the risks? What are the benefits of each of these plans? So as you're going through the numbers, it makes a little bit more sense. For this video, we're just going to focus on the calculator. So we'll get started. I'm going to start with just as an employee only for ease, and then we'll go through each of the other ones. Looks like it's a little formatted. So there's a lot of numbers going on here. It's not overwhelming. Take a deep breath real quick, and we'll just go through each of these. All right. So there are only two spots on this form that you are going to need to edit. Your FTE in yellow and your expected medical expenses in pink. Make sure that if you're a certified classified employee, you put your FTE in as 1 if you're full-time and the correct FTE if you're not. This is going to help calculate your annual premium cost to be correct. If you're a professional or admin employee, please just enter 0 and those costs will be accurate. For expected medical costs, this is what do you expect throughout the entire year you think your total medical expenses might be. If you have no idea what those could be, because that's really overwhelming, we actually have a medical expense calculator here that we can use so that you can better estimate. If you were a part of our plan last year and you want to just review your medical expenses from last year, I highly encourage you to log into your Blue Cross Blue Shield account. It'll have each of your family members for you. Did you hit the deductible? What your expenses were, if you just want to see what you are last year. Otherwise, we can use this best estimate tool and enter how many occurrences of these medical expenses could you expect. So for this case, maybe I'm thinking, okay, well, what could be a worst case scenario for me? Maybe I'm sick a few times. I have to go see my primary care. I get a weird cut on my foot. I need stitches, so I need to go to urgent care. And gosh, I'm a skier and a biker. What if something really big happens and I tear my ACL? Let's go in with that mindset here. So if I think I'm going to go see my primary care doctor maybe twice for this sickness, one time to urgent care for my stitches. When I tore my ACL, I had to go to the ER once for that. I needed an MRI. I needed 5 physical therapy. And likely, gosh, I'm probably even going to need a minor surgery. So just entering those. And those estimate our cost here. Going down, we can think, gosh, well, due to all this change and all this sickness, I really need to go see my mental health provider a few extra times. And then for actually pharmaceutical drugs, I highly encourage you to do your own estimate. They're also different. And then if you have any other medical expenses you predict other than these estimates, you can enter there. So I've entered my number of occurrences that I predict here, and it's going to shoot out here what my possible annual medical expenses could be. So we're looking at about $10,000 for this worst case scenario in my head for myself. So we're going back to employee only. In my pink box, we're going to enter $10,000. Once I hit enter, the calculator is going to run my predicted annual expenses. Going through each of these lines, the first number for each plan is our annual premium cost. This is how much money for the whole year will be taken out of your paycheck to pay for this plan. So whether you seek care or not, these amounts are fixed. And that's what you're going to see as your annual premium. Your out-of-pocket costs are the estimated bills that you're going to see from providers. So what you're going to have to make sure you have savings for, right? Then the total annual expected is the premium plus the out-of-pocket costs that you might expect to pay for that whole year in health expenses. So we can go through each of these. Say I'm an employee only, 1.0 FTE, and I have an estimated $10,000 of medical expenses. I can look and see what might be taken out of my paycheck. And then I can look and see what I will have to have saved up to pay my providers and decide what is best for my situation, and determine, do I want to have the savings for either of these, or do I want to see the bulk of the expenses come out of my paycheck? And we can play around with this, right? Well, gosh, hopefully I don't have tear an ACL. It's unlikely I'm sick all the time. What if I really only have, $1,000 of medical expenses? Now this whole picture changes dramatically. I didn't hit any deductibles. I'll be responsible for $1,000 in medical costs no matter what. And then it really comes down to, where do I want to save in the premiums and take on the risk? So something to play around with of different scenarios. And again, that risk that you want to take on and how much you really want taken out of your paycheck. And for each different type of plan, calculators where you can utilize for each family member. So for example, we can do an example for our family plan, looking at our annual premium costs, out-of-pocket costs, totaling all of the family. And let's say you are a 35-hour classified employee in which you would be a 0.875 FTE. So we'll enter that, and our annual premiums do change a little bit because they are prorated on the hours you work. And then we're going to think about our family. And you think, okay, well, myself, I'm pretty healthy. I'm not going to use that much medical care. Let's just say a low amount there. But my spouse, he has a lot of different medications, sees the doctor frequently. I think his is going to be more like 8,000, just in pretending. Then we're going down to children, and you know you have a really high accident-prone child. We're definitely going to the ER, right? We're going to urgent care a few times. We can guess that one. Child 2, very healthy, barely ever needs any care. And you can play around with each of these. Utilize the medical expense calculator if you need for each of those individuals. So now we're seeing, okay, gosh, my family's total expected medical expenses are upwards of $11,000. We can scroll down, go through each of these plans, review what's going to be taken out of our paycheck, right? 3 very different amounts. And what am I going to owe providers? What am I going to need in savings to make sure I can pay them if these are my expected medical expenses? Again, 3 very different amounts. And when you're deciding, it's just really up to you and your personal preference of where you want to see that money taken out of. Do you want to see a smaller paycheck into your bank account, but see less bills? Or do you want to make sure you're saving money from that paycheck for those future possible or unlikely or likely bills? So I highly encourage you, play around with this, go through different scenarios, and just identify what kind of risk are you willing to take on and what plan might be that best fit. All right, please reach out with any questions. And I hope you find this tool useful. If you have any comments, let me know. I would love to help refine this throughout the years. And have a great day.